name is Amber Bishop and I will be presenting my poster on the physiological process of sleep. First we'll be looking at the physiological process itself, every hormone that is involved and what it's connected to, and the different stages of sleep. Then we'll be looking at a case study of the method, the results, evaluating it and a conclusion, which will then help us to conclude with an effective and relevant conclusion at the end. So first, the physiological process. When our body goes through its 24-hour sleep-wake cycle, 12 asleep, 12 awake, also known as our circadian rhythm, it is mainly a response to lightness and dark. So this process first begins in the retina in our eye. So the melatonin stimulation will begin in the retina, and so will the inhibition of it. So that will then send a nerve to the suprachiasmatic nuclei, which is a bunch of cells within the hypothalamus gland. The suprachiasmatic will then send information to the pineal gland, in which will then maintain melatonin. As darkness approaches, the melatonin will then increase to get our bodies ready for sleep. When the melatonin is secreted from the pineal gland, it will then react to the raphe nuclei, which is found in our brainstem. And within the raphe nuclei, this will then produce serotonin, which will slow down our system, including our heart rate and our blood pressure. So when our bodies start to get tired, we go through different stages of sleep. And what happens is all our neurons try and communicate at once during all these stages. So the first stage is a relaxed state. The blood pressure decreases, the heart decreases, and we start producing what is known as alpha waves. This is normal for someone who is conscious but is relaxed. Within stage 2, it's light consciousness, and we start producing theta waves. These occur when the body is within this stage 2, and it's still quite easy to wake, but in light consciousness or light sleep. Within stage 3, the brain will then start to develop delta waves, which are produced to slow down the body even more as the heart rate does and other body activity such at this stage. Stage 4 is when the body is in deep sleep. The brain produces delta waves, some more delta waves, and is very hard to wake. Stage 5 is also known as REM sleep, or rapid eye movement sleep. This is when our heart picks up a beat or starts beating faster, and our body then goes into a state of paralysation, but our eyes and our heart rate increases. However, all these different stages do not always have to go in order. What is suggested is that you go from stage 1, stage 2, stage 3, stage 4, back to stage 2, and then to stage 5. So you're awake, stage 1, stage 2, stage 3, stage 4, then you come back up to stage 3, stage 2, stage 1, and then into REM, which is then into REM sleep. Okay, next we will be disseminating a case study which I found, which is called The Treatment of Sleep Disorders with Melatonin Medication. The aim of the study was to test to see if melatonin medication could treat children with multiple neurological disorders. Some of them also had ocular or cortical visual impairments. That's either damage to the nerves or the eye, or damage to the occipital cortex of the brain. This was then to examine to see if the children had the same effect without the need of seeing light. So the way they did this was they got 15 children with multiple neurological disorders who had their sleep-wake cycles affected. When the children were chosen, the researchers researched the history of their background. When the children were suitable, they asked their caregivers for consent and then asked them to produce a 24-hour sleep record to get an idea of what their sleep pattern would be like. And this was done for 7 days. Once these records were established, the children were subjected to melatonin medication, either between 2 or 5, depending on the child and the sleep pattern, which was taken before the child's bedtime for 7 days. The children had to go through blood tests, urine tests, and ECGs and things like that before every 3 and 6 months after the treatment had started. The results showed that there was little improvement in their child's sleep. However, the children's mood, had increased dramatically. So irritation was increased, and a couple of children who suffered from epilepsy also showed signs of seizure control. To evaluate this, the positive outcome is that the children and the caregivers both got an idea of what the child might need and to make their mood improve. Therefore, some of the caregivers carried on this medication to help their child. And also, due to the study's reliability of having the standard procedure for every child, some researchers said the melatonin is, quote, future hope to help people who suffer from mental illnesses that affect their sleep-wake cycle. The positive implications of this study is the ecological value, meaning that it was set in the real world. It was set in real situations, and therefore it can help real-world situations for people who do suffer with sleep disorders and their circadian rhythms being affected. So it can then be applied. The application of this study has been significant to helping children with this altered sleep-wake pattern to reach their full cognitive, mental and behavioural development as they grow older. However, a disadvantage I found with this study is that children are still within their brain plasticity stage, so they will be much more susceptible to having medication and adapting to it quicker than somebody older would. So therefore I think people who are older may not work to it as well. As a final point of this presentation, melatonin is seen as an important chemical to help our bodies stay at homeostasis or equal. There has been a variety of research to help researchers to discover what is needed within this physiological process of sleep. By looking at such studies such as sleep deprivation or putting people in a cave that hardly has any light, see whether or not that affects it. Some animals ended up having their suprachiasmatic nuclei removed to see if that would affect it. And society has therefore developed a lot more understanding of these circadian rhythms and addressed medications such as antidepressants or sleeping tablets in order to help these people out. Further studies detailing the links between lack of sleep and the melatonin levels, it could be argued that melatonin itself is an actual cause, that the lack of melatonin is an actual cause to sleep deprivation. But also, as it's suggested nowadays, because younger people are looking at technology, which includes light, their melatonin will then decrease as they're looking at the light of their technology. So a further study that could be done could be to address the causes of these lack of sleep as of rather the symptoms of it, so they could look at why these people aren't sleeping rather than just, oh, they're not sleeping. And that is the end of my presentation. Thank you.